Everyone, in today's class, we are going to see the next type of endoscopy, that is bronchoscope. So the learning objective of today's class is that first we will start with the empathy perspective of this particular topic, why this bronchoscope is very much needed and how it creates very positive impact in patient's life. And then we will be discussing why this bronchoscopy is very much needed when we have a laparoscope and endoscope, laparoscope technique. And then also we'll be discussing the main core topic of this bronchoscope, that is the definitions and how does it works and what are the different types of bronchoscopes. And also we will be discussing the essential equipments or the tools which is being used in a bronchoscope procedure, and what type of the problem which is being diagnosed or treated with the help of this bronchoscope. And then finally we also be discussing the step by step procedure of bronchoscopic treatment or procedure. And then finally we will have a broad discussion about what are the key benefits of using this bronchoscopy in place of other scopes to treat the problem called the breathing related problems. So let's see what is the empathy perspective and what are the problems or the worries which is being collected regarding this particular topic. So first of all, if you see, this bronchoscope is very much specific for breathing problems, breathing related to the patients who having breathing problems. So there are certain cases where the people have difficulty in breathing without any reason, like in unknown cases. They are finding very challenges to diagnose the particular problem with the help of the traditional techniques like imaging modality, X-ray, ultrasound, and CT scan, and so on. So this problem is very much serious because when we have a problem with the difficulty in breathing, even if you start with a normal cold to severe TB or pneumonia, the people started to worries. They will started to fear, and they will have a very great anxiety about what is the outcome of this particular problems or the difficulty of lung related problems. So that is the reason here we are need certain procedures or the techniques to have a clear images of your lungs, so that the surgeon, which enables a surgeon to have a very good diagnosis and treatment of particular problems. What is to identify what is the root cause of that breathing problems. So this is the collective common worries which is being collected related to this particular topic. And also, so then the problem is that they need one such technique to visualize the internal organs that of for your respiratory system, right from your nose to your lungs, okay, the end of your alveoli, so that to identify what type of problem is there. And also we have minimal recovery times. So because the lung related problems is like outstanding, which is for example, if you take pneumonia, TB, and then what else, lung cancer. So these are very much severe, dangerous. It has to be corrected at the early stage. So that here comes the solution as a I say as a outcome of this problem which is being collected. We have bronchoscopy, that is a one type of endoscopy which is highly specialized for identifying the breathing related problems, especially for the lungs. So that is why the name is called bronchoscopy. Okay, the which is very much used to examine the bronchi. That is the two branch of your trachea. Next to trachea, we have a two branches, and then we followed by we have right lobes and left lobes of your lungs. So we will have a total visualization from right from trachea, airways, and then trachea and the bronchi, alveoli, and so on. So the benefit is that we have a very much clear examination or visualization of your total respiratory system, which is very good help for which highly support to diagnose the problem in accurate way, and also we have a very good treatment and as a follow up. So why this, as I said, why this bronchoscopy is very much needed. So as of now, we have discussed the same thing. That is, what is the root cause of this problem, and what is the need. I mean, solution. What need we have to implemented in the procedure, and also we have discussed how come the bronchoscopy comes into picture. So that is what here I have pictured in this slide. So starting with empathy, there are certain lung diseases like, as I said, infections like pneumonia, TB, cancer, which is very much difficult or challenging to identify with X-rays or scans. But thing is that at early stage, if it is extend to the some stage, like after developed condition of that particular disease, then we can easily visualize in the x-rays and some imaging modality. But in the early stage it's very difficult. Even the thing is, we have to analyze in before and well prior, so that we can overcome the further consequence of this particular lung disease. So that is the empathy. The define is that, so we need some sort of technique which is very safe to examine the airways to identify whether it is a cancer or infections or any type of problems. So as a result, we come to know the such techniques, the techniques called bronchoscopy, which provide a very detailed visualization of your airways, trachea, and your both light and left lobe of your lungs. And so it is easy for the doctors to identify the problems in well before, which is being visualized with the help of x-rays and other imaging modalities. So how does the bronchoscope works? So as like the other endoscopes, here this bronchoscope also having the same sort of working procedure, that is working principle. Here we have a lens system, that is camera technology, and then we have insertion procedure, and then we have your like what monitor which is being kept outside to visualize what is there inside, and then we have a pakka examinations clearly to go with either treatment or to diagnosing procedure. So if it is the treatment, we will deliver it the direct medication, or if you want to remove any sort of blockage in the airways, that we can do with the help of like catheters and so on. So many tools are there. So with that we do treatment, or we can do diagnosis. We can easily collect the samples over there, and we will send to the later any sort of laboratory to do further analyzing to check whether what type of infection is happened over there, and what type of stage that particular disease which is being right now. So then we have two types of bronchoscopes. One is flexible, another one is rigid. So flexible, as name implies, it have a flexibility property, so it can be easily navigated to your muscles. Or if you have a rigid type, means it will not flexible as like the flexible bronchoscope, which is it's a single direction. We can easily rigid. If in case if you know the area which is very much near. And easily accessible, then you can go with rigid. If you have a point of targeted area, it's in a complicated place, or the point of access is very challenging, means then we can go with a flexible bronchoscope. This how the bronchoscope its look. We have a different parts. First one, we have the eyepiece, that is the top you can see, that is eyepiece through which the surgeons can visualize, or it can have been attached outside monitor to have a clear visualization or examination of your airway systems. And then we have a option of sending the suction channel. The suction channel importance is that which is helps to suck, that is remove the mucus or any fluids, so that we can have a clear visualization of that particular area. If it is have that, means then it will disturb the, or can you don't have a very much good clarity of image. So that through suction channel we will remove the excess fluids or clear the area or the path. to have a very good guidance and also visualization. And we have options of knob to control the working tip, and we have the options of sending the catheter. That is the that is the one way through which the catheter is being sent to the, and then finally to reach the point of the contact. And then if you see the tip of the channel, working tip, there you can see the three round circles, small circle. One is for channel, that is the working channel, that could be your working channel, or I mean sorry, suction channel, or if you want to give any other accessory channels, then we can use it over there for taking samples or delivering the medicines and so on. And second is that light, you have light source to illuminate the point of the contact, point of the targeted area. And third one, you have a camera to capture the internal images, okay, internal organ images. So this is the different two parts of this flexible fiber optic bronchoscope. And also here I have mentioned the same thing what we have discussed in last slide. These are the few essential components that clearly we mentioned. I mean, I have pinpointed in the previous slide, that is camera system, suction channel, LED light source, and finally one final one is working channel. So what I'm talking about working channel is that this type of channel which is specialized with so many tools like biopsy, forceps, brushes, or laser probes. So these particular tools which is being used based on the type of examination or type of problems we are using this particular bronchoscopes. If you want to collect a sample, then you have to use a biopsy forceps, which is easily enabled to pick up your inside samples slowly without any tissue damage or heavy bleeding issues. So these are the things. Next, we will move on to the bronchoscopic procedure. So here we have a set of five standard procedure we have to follow as like any sort of endoscope procedure. Initially, we have to make what, a preparation of patient. We have to first make the patient so comfort, and you have to sedate the point of area, because we have to send this bronchoscope into through natural opening, not like laparoscope. Laparoscope we have to make small incision through the navel, but here we have to send the laparoscope through your natural opening, that is through your mouth. In some cases we can we can send it through the nose also. Then we have a gentle insertion followed preparation, then we have to insert the that bronchoscope to we have a lens system which helps to navigate the laparoscope, which is being easily guided, and we can kept into the place that is where we want to examine. And then we have a detailed examination followed this procedure, that is here we can have the options of visualize all the internal structures, which helps for the surgeons to go with like identify the problems, or any sort of treatments if it is needed, then we can go with based on the problems. So as I said, the treatments, if it is needed means, then we can give any kind of medications, or if you want to collect any samples for further analysis, that we can go. And then finally we have to complete the process. That means the once the after all the process is being done, then this bronchoscope has to be removed safely. Then we have to make them to stay in the hospital maximum 5 to 6 hours. On same day we can send them to the send them to send them back to their home on the same day itself. And then so that without any much hospital stay, or a post surgery, or some post surgery time, then we the patients are very free, they can carry out their uh, daily activities. So what kind of conditions we can diagnosed and treated in the sense, first one is the lung cancer, as I said, which is because the lung cancer is something which have a very high fatal, mortality rate compared to the other cancers. The topmost cancer is like breast cancer, and next second most is the lung cancer. But compared to the breast cancer, the mortality rate is low. It is not much greater than the lung cancer. So lung cancer is heading so high, placing the topest level of the cancer, which is having very high mortality rate. So this particular cancer, if we have the options of diagnosing at the early stage with the help of these many applications of endoscope such as a bronchoscope, then it is a very high chance for the person to have a healthy life, a safer life, quality of life, and so on. So second one is TB. It also one way of very chronic problems. We have to examine the airways. So this bronchoscope is helping, enables the surgeons to examine the airways, and followed by we can give the treatment based on the problem. And then we have bronchitis, that also one type of airway inflammation, that bronchoscope enables surgeon to assess what type of inflammation, what type of mucus is found there, was found there, that which is being collected, and we will send to the laboratory for further analysis to identify the infections agents or any type of pus, what what stage the progress of that particular inflammation or mucus protections are there, that we can do assessment with the help of bronchoscope technique. Then pneumonia also, we will identify what type of infection agents are there with the help of bronchoscope. So finally we have a very good key benefits of using this bronchoscopes. The first, as I said, we have a direct visual access, which is not easily possible with other X-ray techniques and so on. And then we have a direct reduction, ear reductions, which is very much recommended in case of very serious disease like lung cancer and pneumonia. And third one is minimally invasive approach. Yes, it is not needed for a large cut, huge bed loss, and so large, extended hospital stay, long recovery time. It is nothing is going to have in this type of bronchoscopy. So that's why it is very much recommended compared to the other traditional surgery method. And we have same day treatment. So once the problem is diagnosed, immediately we can go with the treatment also in immediate on same day. So the next, I have given here activity which is being played and during class hours. That is a think, pass, share activity. Here, the individuals will be given with one technological innovations that they have to do research, and they will find, and then they have small discussion with their partner. That is a class, their friends. After discussions of small brainstorming section, then then they both two people will come in front of the class as a pair. They will going to discuss whatever the discussion, what are the information which is being collected during their process. The information will be disseminated to all over the classes. So that is how this think challenges activity will be carried out. And then these are the three assessment questions which has been posted here related to this topic. uh, Last, we have a mind map, that is a summary of this today topic, bronchoscope. So, as a summary, in today class, we have discussed right from starting, that is beginning. We have discussed what is mean by laparoscope, bronchoscope. Before that, we discussed what is the empathy perspective, and then slowly we identified what is the problem, that is the empathy. Then we defined the uh, like what is the common worries and so on. Then come we get to know what type of solution is being expected by the people like patients and doctors. And then we discuss how does this bronchoscopes comes into the picture. And then slowly we move on into the types of bronchoscopes, working principle of bronchoscopes, the benefits, procedure, and so on. So that's all about today class. Thank you.